name is Clarke. I'm an orthopedic surgeon at Erlanger Orthopaedics and Sports Medicine. I practice in Murphy, North Carolina. I've been an athlete since I was younger and always been interested in athletics. And then when I became interested in medicine, it just kind of carried over to kind of dovetail with my personal interests and professional interest. I did an orthopedic surgery residency and then did a fellowship in sports medicine to focus more on the sports athletes, but I do more of a general practice. I also spent some time in Europe doing an international fellowship to get the international perspective on orthopedics, since they are pretty much responsible for a lot of these rods and plates and screws that we use now. That stuff generated in Germany and Europe, so I wanted to go and get some of their perspective on what they do. Erlanger has a broad outreach in the community, and they have a lot of diversity for taking care of patients. And I enjoyed the smaller communities, and this was an opportunity to be in a smaller community and to hopefully help people that don't have to travel so far to get orthopedic care. So I think that's what drew me to the opportunity at Murphy. Since the inception of my practice, I've always focused on one-on-one contact with patients. So I've not really gotten into the area of extenders, as they say, physician extenders. Not that there's anything wrong with them, but I think they do take away some of the time you get to spend with the patient, or you expect them to. And so I like to meet the patient, be the first one to examine and talk with the patient, go over test results, radiographs, things like that, discuss the problem they have and the treatment options. And so I've always been involved in that from the inception, and I still want to continue to do that. And again, in a smaller community, I think you have more of that opportunity. There'll be people assisting me, of course, but I want to get hands-on and have the patient know me in a one-on-one relationship. And if I have questions, I can answer those, and it won't be answers coming from 2 or 3 different sources. So I think that's one-on-one contact with the patient from beginning to end of the issue is something I prefer more than jumping in at various points along the care of the patient. Once you've established the most likely cause of their pain or diagnosis, orthopedic injury they've had, whether it's a rotator cuff tear, a fracture, joint pain, then you can progress on to the treatment options. And I think the most frequent question would be, what are my options? So I think that's where I have probably more of a special interest in explaining the different options to a patient rather than saying, well, you need to do this and it's surgery. Oftentimes it's not surgery. And so we can always come to those discussions and see what's best for the patient and what their situation may be.